Welcome to the Blood Bank Laboratory at the Royal Derby Hospital. We are located on level 5 next to the main pathology reception. Blood Bank is open 24 hours a day, 7 days a week, but staffing is reduced Monday to Friday between 9 p.m. and 7 a.m. and all weekends and bank holidays. During these times, please ring the bell in pathology reception and they will alert the biomedical scientist on duty that they are needed in Blood Bank. Blood Bank Specimen Reception Area. Blood Bank Laboratory is responsible for testing all pre-transfusion samples known as group and screens and providing blood components for transfusion to patients in the hospital. On receipt, every sample is carefully checked against its accompanying request form. The sample and request form must be labelled with a minimum of the hospital number or NHS number, forename, surname and date of birth. All details must match identically on the sample and the request form. These details must then match with the patient's record on the laboratory computer system. The sample must also be signed by the person taking it and include the date and time the sample was taken. We have a strict zero tolerance policy, which means that if the sample is mislabelled and does not fulfil the minimal sample labelling acceptance criteria, it will be rejected and the patient will have to be bled again. This is to ensure that, if needed, the right patient gets the right blood when transfusion is required. After labelling checks are performed and accepted, the blood sample and form are labelled with a unique barcoded number. Booked in and centrifuged. Centrifugation separates red cells from the plasma for testing. Analyzer area. Group and screen samples are processed using a fully automated blood group analyzer which provides the ABO blood group, the RHD blood group, and an antibody screen which identifies the presence of any red cell antibodies. If the presence of an antibody is detected in the antibody screen, further testing must be done using a special antibody panel to identify exactly which antibody or antibodies are present, so that we can provide the patient with blood that is compatible with the antibodies that they have been detected. A group and screen takes around 30 minutes to perform, but if there is a discrepancy in the results or antibodies are detected, it will take considerably longer to complete. All analyzers and equipment are regularly maintained and quality controlled to ensure all results are accurate. The Blood Bank Laboratory is compliant with the Medicines and Health Products Regulatory Agency and accredited by the United Kingdom Accreditation Scheme, which is visible to service users. Red blood cell stock fridge. We have 4 different blood components routinely available for transfusion. In this fridge, we keep our stock of units of red blood cells. Royal Derby Hospital is classed as a high user of red blood cells, transfusing more than 1,000 units of red blood cells per month. It is a legal requirement to obtain positive proof of transfusion for each unit we issue, and this information has to be kept for 30 years. We keep stocks of all ABO blood groups, which are mainly standard red blood cells, but we also keep small stocks of neonatal packs and irradiated red blood cells. It is important that patients who need irradiated blood components are identified by their clinician and that Blood Bank is informed as soon as possible so that we can put an alert to this effect on the patient's record. These patients are at risk of transfusion-associated graft versus host disease if transfused with standard components. Irradiated blood has an indicator label to confirm it has been irradiated. FFP and cryo freezer. We also store 2 frozen plasma components, FFP, fresh frozen plasma, and cryoprecipitate. FFP contains small amounts of the clotting factors and cryoprecipitate is rich in fibrinogen. Both are usually indicated for bleeding patients to replace clotting factors and fibrinogen lost during hemorrhage. FFP and cryo are stored as frozen components and require defrosting prior to transfusion. This process takes around 20 minutes from time of request. Platelet incubator. Platelets are kept in this incubator. It maintains a warm temperature, 20 to 24 degrees, and keeps the platelets agitated to prevent them clumping together. Because they have to be stored at this temperature, platelets have a very short shelf life of only around 7 days from the date of donation. To prevent wastage, we only have 1 unit in stock at all times for emergencies, and all other units of platelets are ordered on a named patient basis when required. Please communicate with Blood Bank as soon as you know that a patient will need a platelet transfusion so as to minimise any delay. We currently obtain all of our blood components from NHS Blood and Transplant Stock Holding Unit in Barnsley and have 2 deliveries a day in the week and 1 a day at weekends. We constantly monitor our stock levels and place orders accordingly to maintain our normal stock levels as best we can. Crossmatch bench. When a patient requires a red blood cell transfusion, the biomedical scientists have to make sure the blood is compatible with that patient. This test is called a crossmatch. There are 2 different types of crossmatch available. The first is electronic issue, where compatibility of a unit of red blood cells is determined by the computer. This involves looking at the patient's blood group results and information about the unit of blood which is being issued to that patient by the biomedical scientist and ensuring it is compatible. Most patients will be eligible for electronic issue after they have had 2 group and screen samples tested and they don't have any antibodies. The second is the serological crossmatch. Any patients with antibodies or discrepant blood group results will require serological crossmatch. This is a manual test that requires the biomedical scientist to incubate some of the patient's plasma with a sample of donor red blood cells taken from the unit to be transfused. If there is no reaction between the patient's plasma and donor red blood cells, the unit of blood is compatible and safe for transfusion. Electronic issue takes around 5 minutes compared to 45 minutes for a serological crossmatch. Kleihauer bench. During pregnancy, all antenatal booking and 28-week samples are tested for ABO and RHD blood group as well as an antibody screen. RHD negative pregnant ladies are offered routine antenatal anti-D prophylaxis to prevent hemolytic disease of the newborn during their pregnancy. If these patients experience a potentially sensitising event after 20 weeks gestation, such as a PV bleed, a Kleihauer test is performed to identify any feto-maternal hemorrhage. This test will enable us to estimate how much fetal blood has crossed the placenta into the maternal circulation, so additional anti-D prophylaxis can be given if necessary. Issue fridge room. When red blood cells are issued to a patient, they are stored in the blood fridge in the issue room, ready for collection by the clinical area, which is easily accessible. Access to this room is by swipe card, by trained and competency-assessed members of staff that are able to collect blood for transfusion. All blood components must be carefully checked prior to taking to the patient bedside for transfusion. We also have emergency Group O red cells in this fridge, which are available for collection in an emergency for a patient who doesn't have a valid group and screen sample for crossmatch or cannot wait for a sample to be processed before being transfused. For these patients, it may also be necessary to activate the massive hemorrhage protocol. This will ensure that Blood Bank is aware of a massive hemorrhage patient and can react appropriately by ensuring prompt supply of blood components required. Any transfusion of emergency Group O red cells must be authorised by a senior clinician because even though Group O is seen as safe for all in an emergency, it is not compatible with a small percentage of patients and should only be given in life or death situations. When a unit of emergency O blood is collected, it must be signed out on the collection sheet, with details of the patient to whom it is to be transfused. This ensures that patients' laboratory records can be updated with details of the units transfused after the event. Thank you for watching this short tour of Blood Bank. We hope you found it interesting and useful. For any further inquiries, please do not hesitate to contact Blood Bank directly.